Welcome back. In the chapter of Preventive Medicine and Obstetrics, Pediatrics and Geriatrics, today in this session we will be discussing about the periods of growth. The periods of growth is we have three divisions, that is prenatal period, perinatal period and postnatal period. Prenatal period is the period during the pregnancy wherein we have three subdivisions. See, during pregnancy we have ovum, embryo, fetus. Ovum, embryo, fetus. So when it is considered as an ovum, when we see that when it is from fertilization to 14 days, from the day of fertilization until the 14 days, it is considered to be as an ovum. Next, from 14th day, that is 2 weeks up to 9 weeks, it is considered to be as an embryo. So we see that here they have given embryo 2 weeks to 9 weeks. We can see in the picture here 2 weeks, that is 14 days to 9 weeks, it is considered to be an embryo. Last we have fetus. From that ninth week until the baby is born, till birth, it is considered to be fetus. So this was about the prenatal period. Let us summarize with this. Prenatal period, guys, from fertilization to 14 days, it is considered to be ovum. From 14 days, that is 2 weeks, from 14 days, that is 2 weeks to 9 weeks, it is considered to be an embryo. And lastly, we have fetus. Fetus, when it is from 9 weeks until birth, it is considered to be fetus. Okay, so with this it's clear. Prenatal period is clear. Now we're moving on to perinatal period. Perinatal period is from 28 weeks to 7th day. According to the World Health Organization, it is from 22 weeks to the 7th day. World Health Organization says it is from 22 weeks. The textbooks like SPM textbooks, Spark and so on say that it is from 28 weeks. So when the examiner asks you whether it is 28, if he cross questions, you can say, sir, according to the World Health Organization, it begins from 22 weeks to the 7th day after birth. Okay. Now we move on to the postnatal period. Postnatal period is the period after the birth of the baby. The postnatal period, the baby is referred to as a neonate. Who is a neonate? From the birth to 28 days, 1 month, okay? Till 1 month approximately, he is considered to be a neonate. Neonate is the one from birth to 28 days, okay? Birth to 28 days is a neonate. Again, it is further divided into early neonate and late neonate. You can see early neonate and late neonate. Early neonate is from birth to 7th day. From birth to 7th day is an early neonate. From 8th day to 28th day is a late neonate. Okay, I hope it's clear. Neonate, we saw neonate is from birth to 28 days, early and late neonate. Lastly, we have post-neonate. Who is a post-neonate? Post-neonate is from 29th day to 1 year. So we see that birth, 7th day, till 7th day we have early neonate. From 8th day to 28th day we have late neonate. Let this be 1 year, okay? 1 year. Let this be birth, let this be 1 year. Okay. So next, we have post-neonate. From 29th day to 1 year is a post-neonate, and infant is from birth to 1 year. Okay. So this was all about postnatal period and post-neonate. Let us summarize everything, guys. Prenatal, fertilization to ovum, 2 weeks to 9 weeks. Then from 9 weeks to birth. So this was 9 weeks to birth was a fetus. From 2 weeks to 9 weeks was an embryo. So this was all about it. Perinatal, we know, very easy, 28 weeks to 7th day of birth. World Health Organization, 22 weeks to 7th day of birth. Lastly, so we'll see a birth, and this is 1 year. In between we have 28 days. Okay, so we see that from birth to 1 year is an infant. Okay, this is an infant. Now birth to 28 days is a neonate. Neonate, early neonate, late neonate. Early 7th day, from 8th day to 28th day is a late neonate. Now 29th day to 1 year is a post neonate. Post neonate. This is late neonate and this is post neonate. 29 to 1 year is post neonate. So I hope it's clear. With this we come to an end of the periods of growth. In the next video we will be discussing about the antenatal care. If you like the video, hit the like button and subscribe. If you have any doubts, please put it in the comment section. Thank you.